Basically, reading, we have one complete hour for the reading. For part A, we have 15 minutes time, and there are total 20 questions. For part B and C, we have 45 minutes time, right? So we have 6 questions in part B. These are multiple choice. We discuss tomorrow. And for part C, we have you can say uh, two extract 1 and extract 2, and there are total of 16 questions. Let's start with part A. Let's say in part A, they are going to give you 4 texts, A, B, C, and D. If the main topic is COVID, so let's say in part A, they might be discussing about the history, definition, or types of COVID. In part B, they can discuss about maybe treatment record, maybe symptoms, and so on. In part C, again, treatment or specific type of treatment. In part D, is case study or prevention. So there are 3 different nature of question. Let's say for 1 to 7, we have matching question. From 8 to 14, it's a sentence completion. And from 15 to 20, we have fill in the blanks. So what we have in 1 to 7, let's say this is a question, what are the common symptoms of COVID? For the sake of example, in text A, if they have mentioned about history and somewhere down the grade, they do have mention about the common symptoms, right? So you can see, although the symptom paragraph was of C, but right now they are asking about the common symptoms. So rather than asking C, we can write it down A in front of the answer over here. Anyhow, so there are 2 different type of question in 1 to 7 as well. The first one are the keyword based question, and the second one are the we can say vague statement, right? Keyword based and vague statement. Now 8 to 14, we have sentence completion. So there will be again keyword based and vague sentences. So in sentence completion, you have to write down word or phrases. It should be exactly the same word from the text. We have then fill in the blanks. So in the fill in the blanks, there must be again keyword based and a vague statement as well. But whatever you write down, the answer should be grammatically correct. Or in other way around, you must have an appropriate word or phrase. Let's say if your answer is in the fill in the blanks, if your blank is preceded by a, article a, or an, your answer should be singular, no matter if you have the plural answer, plural things written in the text. So then in this part, another thing, if you are going to start your question with a blank, so the first letter of the blank should be capital, even it's a common noun. And sometimes we have to change the form of the word from noun to verb and adjective, and from adjective to noun and verb, so on. So most important thing that most of the candidates won't focus on is this is your speed reading skills with an ability to retain the information, like a good short-term memory. So you should have an ability to retain the information. Let's discuss about a strategy. In terms of strategy, we have deep reading skills. Deep reading skills mean read all the things in the text. Mean you have 5 to 6 minutes time to read all the text. So let's say after reading this 5 to 6 minutes time, you can go for question number 1 to 7 within 30 seconds. And then 8 to 20 in one go, like without looking back to the text, just read the question. Quickly, just write down the answer from your memory. If you didn't get any question, just move on. And at the end, you can go for the rest of the question. Like let's say, what we mean to say, if you want to go back, you can. But 6 minutes time for reading, and from 1 to 20, from you can say rest of the question, you can go for the 9 minutes time, right? So you have to complete the task in 9 minutes time. So the next method is skimming and scanning. In skimming and scanning, there is first method is to read the text first, and second is read the question first. It's up to you. But whatever you are finding, the read the text first, just read all the paragraphs, like first 2 lines or first 2 sentences or last 2 sentences. Extract the gist or the central idea. Okay, let's say history and common symptom, it was in A, and so on. So this is the way you can go for the reading part. I hope it will be helpful for you. So for the sake of example, if this is our text, we have 1 to 7. These are basically matching question. These are matching question. 8 to 14, These are sentence completion. You have to write in word or phrase, right? 15 to 20, it's your fill in the blanks. Here you should write down appropriate word. So, let's say we will do the text with skimming and scanning first. I'll quickly read a paragraph. So let's say we are not going to do a detailed reading over here. You just read the headings. You would have an idea. Okay, these are 3 different types of fracture that has been mentioned, and we can read the important things. Let's say dislocation, outstretched hand, some important word. Then we have management part. In the management part, we had, let's say, pressure bandage, immobilize, pain relief. In clinical assessment part, we have patient history, right? When we can see painful swelling, shape, warm, bigger, right? Then for the management part, we can also mark some keyword. Let's say splint, plaster back slab, reduce the pain, alleviate, pillow for leg injuries, sling for arm injuries, administered analgesia, morphine and fentanyl. Okay, compartment syndrome as well, if it's not necessarily relevant. Then we can see these information in the text. After reading this part, you have an idea they're talking about a medical officer and next practitioner. So intramuscular morphine intravenous, and this range is important, right? So afterward, we can see there we have less than 70 years, vomiting, respiratory depression. Then we have technique for plaster back slab. Okay, measure the length of cotton stockinette. Cotton padding, important. We read all the sentences. We are not going to miss anything. Let's say read everything. And so on. So once you read all the paragraph, you can go to the questions. Let's say what should we use to alleviate a patient fracture leg? If I recall, fine. If not, we can recall, we can write it down. If not, we can go to the paragraph and look at it. Was in B in the management second line. What is the maximum dose of morphine per kilo? The keyword is maximum dose of morphine per kilo. Go and see the text basically. They are asking you about the maximum dose of morphine per kilo. They have written 10 mg. Most of the candidate would write it down, but they are asking you about the maximum dose of morphine per kilo. So this is the range, and we can write down 0.2. This is the range, and we can write down the 0.2 as the answer. Similarly, what is the maximum dose of morphine we have done? Which part of limb may need extra padding? So we need to recall where it was, the extra padding. So now we can see extra padding was written over here. Okay, so this is the answer. Similarly, we can see the next question. What should be used to treat a patient with respiratory depression? We remember it was in C, and we can write down the answer. And when moving on to the part B, make sure that answer should be grammatically correct. And at the end, without looking back to the text, we can go quickly and you can write down the answer A to D. Let's say procedure for delivering pain relief. We can see that this is your C. The procedure to follow when splinting a fractured limb, it was delta. The record when assessing a patient, assessment was in B. The term used to describe different type of fracture, it was in A. The practitioner who administered analgesia, it was in C. And what to look for when checking an injury, it is in B. And how fracture can be caused in A. So I hope in this approach you can do it well. I will repeat it for you. First of all, You will skim and scan the whole